Get it right. Sarah Atherton.
Thank you, Chair. I wish to speak against two amendments to this bill, in particular Amendment 1 in the name of the Honourable Member for North East Fife and New Clause 1 in the name of the Honourable Member for Hayes and Harlington. Now, Amendment 1, quite simply, is impractical. Employers, HMRC and payroll systems do not have the time to bring this into effect by April. Our own pay body, IPSA, could not make these changes in time, let alone SMEs and bigger companies. July is the earliest this can be done, and the government should be commended by the pace in which this will be universally introduced, bearing in mind we will be midway through the financial year. This government understands the needs of constituents, and the cost of living challenge is hitting now, post-COVID, and they are acting with haste. On New Clause 1, my opposition is similar. Timing. We should not postpone by undertaking impact reports, which would cause unnecessary delays for families needing support with the cost of living as soon as possible. Now, Chair, Wrexham has more than the Welsh and UK average of lower income households, and under the Welsh Labour administration, for the past 22 years, these numbers are increasing. That's more child poverty, more struggling households. And we all accept that this situation has not been helped by the global pandemic, which none of us foresaw, nor did we see the war on the fringes of Europe. And I know, Chair, that this is not strictly within the remit of this bill, but I would like to concur with the honourable friend for Dorset South in his call to increase defence spending. Now, going back to the bill, this national insurance threshold increase will save those families in my constituency of Wrexham hundreds of pounds per year, and that's in addition to the help this government has already provided with the increase in the national living wage of 6.6% and the comments made by my honourable friend for Peterborough in the second reading, who mentioned the change in the universal credit taper rate. Therefore, I find it perplexing that Labour opposite would challenge this bill that benefits my constituents and 2.2 million people across this country. And in Wrexham, there are two areas which the Welsh Labour government have declared amongst the most deprived in Wales. This bill will directly help them. So why is Labour opposing this? Do they not want those people living in those areas to be financially benefited? The Chancellor has an excellent fiscal policy, a responsible one, based on fairness and understanding of need. And I just briefly mentioned the health and social care levy within this context. The importance of ring-fencing this revenue cannot be underestimated. The number one challenge facing my constituency in Wrexham is accessibility to quality health care, which as a former nurse and social worker, I understand acutely. Now, accessing a GP, years on waiting lists, ambulance wait times, people having no choice but to pay privately and take out loans in Welsh Labour-run Wales is unacceptable. And people moving over the border to England is unacceptable. And I'd urge the opposition to understand the needs of their constituents and understand that people want good public services and low taxation. And lastly, Chair, let's not forget, the Welsh Labour government will benefit through the Barnett formula for this levy. This government is fiscally responsible, committed to spending where needed, and for my constituents of Wrexham, this is the deed to the words of levelling up. Thanks, Chair.